In today's episode, we're talking to Dr. Veronica Couture. Dr. Couture is an integrative psychiatrist here at Pacific Integrative Psychiatry. And if you'd like to learn more about optimizing your mental health and well-being, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm an integrative psychiatrist and sleep physician, and I'm the founder of Pacific Integrative Psychiatry. We see patients all across California via telemedicine, and we specialize in helping people with depression, anxiety, burnout, and sleep disorders. So today we're talking about spirituality and mental health, which I think is a really fascinating topic. So Dr. Couture, I'll turn it over to you. I'd love to just hear a little bit more about your background and why you're interested in this topic of spirituality and mental health.
Yes, thank you, Dr. Bhopal. So yes, I'm an integrative psychiatrist, and I do work mostly with folks that need help with anxiety, depression, sleep issues, and trauma, actually. We find a lot of trauma deep down in there. And one of the things that fascinates me about people is the mystery of what's behind their eyes. What is their authentic self, and what does their spirit tell me? I love a mystery, and I love to explore the edge of what we know. And I've always just wanted to know more.
That's so beautiful. And I love how you put that, the mystery behind their eyes, because, when we talk about spirituality, it's such a deep topic and it means different things to different people. And, sometimes when we use this word spirituality, people might think of new agey things like using crystals and things like that, or they might think in terms of organized religion. But those are two kind of extreme ends of the spectrum, and there's a lot in the middle. So I'd love to hear what spirituality means to you.
Mhm. Well, basically, it comes down to the seeking of meaning, of purpose, of connection, and transcendence. And we do think about religion, like you said, and metaphysics, and those can be forms of spirituality. Absolutely. There are many paths to achieving spirituality, including religion. And in fact, the root of the word religion is ligare, which means to bind, a liga. And when religion is good, it binds a person to their authentic self and others as loved creatures of God.
It's beautiful and so interesting too about the root of the word religion meaning to bind, because if we also think about other forms of spiritual practice, that notion of binding or of union is quite prevalent. And so
Mhm.
I'm thinking about yoga and how in Sanskrit, the root of the word yoga means union. And it's about union with the mind, body, spirit, and forces greater than oneself. So it's interesting to see those parallels there.
Yes.
So, okay, when we're talking about spirituality, as you were saying, there's lots of different aspects to it. Why is spirituality important when it comes to mental health and overall well-being? What is the role of spirituality?
Well, if you imagine, and we've all been through this, but having an illness, whether it's physical or emotional, maybe it's heartbreak, and experiencing adversity, it can be isolating. It could be draining of your energy and your spirit in a way. We can look at it that way. And it can make you wonder, why is this happening to me? It can make us feel wrong in the world and make us doubt why we're even here, what our purpose is. And I think that we need to feel that our suffering has meaning and that we have purpose in the universe. We need to feel that we belong and that we're not alone. So, having spiritual beliefs and practices can help provide this and lessen the load that we carry.
Yeah, and I like how you frame that it can help us make sense of things that don't make a lot of sense. In life, lots of things happen that logically don't make any sense. So having a spiritual framework or practice can absolutely provide comfort and just a different level of intelligence and understanding, I think, in life.
Yes.
Yeah, and it's interesting as well to see how spirituality in psychiatry is changing. There was a time where it just wasn't part of the work that we do, and now the pendulum is swinging in the other direction. So how do you incorporate spirituality into the work that you do with patients?
There's a lot of ways that this can be done, but first of all, I take the time to ask about it, which we don't always do in medicine. We ask a lot about the facts, but we don't take this into account. And I think it's really important that we do. So in my assessment and in my planning for treatment, I do take this into account. Sometimes folks have had spiritual spiritual beliefs or practices that have given them comfort in the past. They've grown away from that and just need a reminder that that relationship is still there when they need it. Sometimes a person's beliefs can be a source of pain or fear, and that can be explored. It can be fruitful. Another example is if I know that my client is of a particular faith, I might suggest that we recruit a holy person in their faith to assist in their healing.
And that's really a culturally sensitive way to approach care based on the person's, cultural background and their experiences and the role that spirituality plays for them. And I also appreciate how you mentioned that for some people it can be a painful source for them, especially if they grew up in maybe a religious household that didn't align with their authentic beliefs.
Oh, yes.
Could you speak a little bit more about that?
Yeah, so, I come from the Catholic tradition. That was my cultural religion. And, for somebody, it may, if they don't fit in, if they don't align, their authentic self doesn't align with the spiritual beliefs, it can definitely cause isolation, fear, shame, fear of being judged, not just by their community, but by a higher power. And that can be crucial, exploring that and helping a person regain or find that feeling of connection and love and unconditional love.
Yeah, that's such a powerful process for a person to go through. And so I'd love to hear a little bit more as well about how you might work with a patient to connect with, using spirituality in the work that you do with them, if they don't necessarily have a spiritual practice or a spiritual belief. How might you navigate that?
Yes, that's pretty common, actually. And what we might do is we might talk about those things that help them to feel connected, that help them find meaning in their experiences and purpose in their life. So it could be all sorts of things. It is very individual, and that's one of the fun things about talking about this. So it could be family, it could be nature, music, art, dance. For some people, it's animals. It can be activities like surfing or rock climbing or something like rebuilding a motorcycle. I mean, you can find spirituality in amazing places.
That is so true, that it doesn't have to be, what might traditionally think of as a spiritual practice. And again, sort of using yoga and meditation as an example, one of the tenets that is spoken about is that you become meditative, you become spiritual, that it's not a separate practice.
Yes.
It's not like, okay, I'm doing my, practice for 10 minutes or 5 minutes or whatever, or an hour in the morning. It actually becomes a part of your life and it's woven into everything that you do.
Yes, I agree. I've noticed that as well. And, the spirituality it's whatever gets you into the flow. That feeling when you are at peace, there is no resistance, there's no space or time.
Yes. Yeah. And that's kind of a feeling that can be quite elusive for people sometimes.
Yes.
I think most people have experienced that at one point or another. And so how might you encourage someone to, or, guide someone to experiencing that flow?
Sometimes it's identifying where they felt that before, and that can trigger a memory, and we can pursue that further. Or sometimes it's in trying something new, which, a lot of benefits to that in itself, right?
Yeah, absolutely. So what about personally? What are some spiritual practices that you engage in or that you find helpful?
I love to talk about this because I find so much benefit from it. And I've seen so much benefit just, over the years, and increasing my peace of mind and feeling more present for my patients, and even lowering my blood pressure amazingly. I can't promise this for everybody, but that's what I feel it's really helped me with. And I'd love to share about one of my own practices. So most days, especially after work, I go to the woods behind my house, or if I really need powerful healing, I'll go to the shore, as I live on a bay. And one of the first things I do is to give gratitude for what I've been blessed with. And that depends on whatever it is at that day. It's not always the same thing. And sometimes it's very basic things. And then I ask for assistance with whatever I need help with. And I do a cleansing ritual where I imagine that with the breath that I inhale, I pull up the energy of the earth up through my feet, through my body. And as I exhale, I imagine pushing it up through my crown up into the sky. And then as I inhale again, I pull a healing white light down through my crown, through my body. And as I exhale, I push it down through my feet, down into the earth. And next, I lovingly release any energy that is not my own, that I'm carrying with me, or that I no longer need from myself, from my property. And I ask my spirit allies to heal these energies. And finally, I fill myself, surround myself and my home with a protective bubble of light. And I just wrap it up by saying, and so it is, or amen. And I give thanks one more time.
Gratitude is such a powerful practice. And as you've just described, it's very simple.
Mm-hmm.
It doesn't take a lot of time. It doesn't take any special training or equipment or resources or anything like that. It's something that people can practice on their own. And for anyone listening who's kind of data driven, it is shown that practicing gratitude can actually help with sleep. It can help with reducing depression, anxiety. Spirituality in general is shown to help improve symptoms of depression and anxiety. And it also helps instill feelings of awe and compassion in people, which can be quite helpful for mental health and well-being. So that was a beautiful practice that you just shared. And I'll just also reflect on what you were saying about it, what you're grateful for is different every day. And I think that's important, because sometimes when we're doing a gratitude practice, if we're saying the same thing every day, it can start to lose meaning.
Right.
And we don't pay as close attention because we're just kind of going through it like a checklist.
Yes, that's right.
Really reflecting on the day and what's happened and what's been offered to you that day.
That's right. There's not just the saying of it, which is important. The words, the vibration of the sound is important, but also the feeling and experiencing that gratitude.
Yes.
Mm-hmm.
Yeah. And something I recommend to people as well is, if they're so inclined, is to write down what they're grateful for,
Yes.
Especially for people who find journaling helpful. It can be helpful just to write that down, and then you can go back in the pages and reflect and remind yourself of, oh my goodness, there's all these things in my life to be grateful for. Yeah. Or another exercise I sometimes recommend to people is to write it down on little Post-it notes, and then like each thing that you're grateful for, one per note, and then put them in a jar. And if you have a family or a partner, you can all participate in that. And then once in a while, open the jar and take the pages out or the little bits of paper out and review them. And it can be a fun communal activity as well.
I love that. That would be a great thing to do with kids.
Yes. Yeah, definitely. Is there anything else you'd like to share about your personal practices, or maybe practices that you share, spiritual practices that you share with patients?
So as I work with folks, I do use spirituality in a variety of ways that you may not even know that I'm doing it. And in the sense of, what I do is much more than occupation. It's a calling, right? And I believe that the relationship between doctor and patient, which is an ancient one, is a sacred relationship. So I see a whole person in front of me, mind, body, spirit, here, now, and everywhere and every time. So I recognize the eternal spirit within you, within your physical body. And I think that's really important. I'll be sure that I'm right spiritually when we work together, so that I'm not carrying that emotional energy from myself, from other clients that I've had during the day, and so that I can best hold that space for you and only you when we're working together. And we would work within a person's spiritual or religious beliefs and integrate that into the healing plan. Otherwise, we might discover new beliefs or practices together. So, for example, we can create together a spiritual practice, rituals or ceremonies that are meaningful. We can explore spiritual experiences that a person has had, whether they were positive or negative.
And it truly is a personalized approach. There is no one size fits all approach that, okay, everyone needs to do a gratitude jar now or anything like that. It really is tailored to the person in front of you. And like you said, the person might not even know that it's the spiritual practice or that you're incorporating those elements, but you're really looking at how to leverage the tools that the person has already and how to build new ones that are aligned with their lifestyle and their beliefs.
Yes.
So what are the benefits of working with a psychiatrist to understand spirituality? Because as we were discussing, this is not something that, is necessarily part of psychiatric treatment or therapy. Not all doctors take this kind of approach. So what's the benefit of working with a doctor who does take this approach?
Well, we go deeper into the root of whatever it is my client is working on. So if it's depression, what is the root cause? And a lot of times, events that may have happened in childhood that may have affected their attachment with their primary caregiver, their parents, for example, or maybe a traumatic event. It helps to view it not just as how has this affected the nervous system, the nerves, the chemicals in the body? How did it affect the heart? I think that is the basis of really what we're doing in psychiatry is we are treating the heart, not this physical heart, So we need a language and a system to talk about these things that are not physical, that are not tangible, but yet play a role in our well-being, in our illness.
Yes, and absolutely. And, again, tying that back to concepts in yoga and Ayurveda, in traditional Chinese medicine as well, they
Yes.
say that the mind is actually in two places. Like in Western medicine, we think of the mind as being in the brain, right? In the head.
Yes.
Whereas in traditional systems, they say the mind is in two places. It's in the head and it's in the heart.
I have no doubt.
Yes. So if people are interested in learning more about you or working with you, because you see patients across California by telemedicine, how can they find out more?
Yeah, so if folks are interested in learning more about how I work with clients and utilize spirituality in healing, you can go to our website, the Pacific Integrative Psychiatry website, and find out more.
Excellent. Yes. So we'll put the link in the video description below, and we'll also put the link on the screen here. So it's pacificintegrativepsych.com. Dr. Couture is accepting patients for integrative psychiatry, which is really a whole body, whole person approach to mental health. It includes medication management when that is appropriate, and it includes other modalities as well, including some of the ones that we've spoken about today. We do offer a free 20-minute call. So if you're not sure if this approach is right for you, you can schedule a call with our intake coordinators, and they will help you assess your situation and see if we're the right fit for your needs. So again, you can check out more on our website. Dr. Couture, thank you so much for being here today. I'm really grateful for you and really grateful that you've been able to share some of your experience and wisdom with us today. So I appreciate your time.